Coronavirus deaths edge near SARS total of 774. Virus update. The death toll from China's coronavirus outbreak is inching closer to the total from SARS and may surpass the threshold today or tomorrow if the disease continues to kill people at its current pace. The latest illness is clearly spreading at a faster rate. The global toll has reached 724 in about 2 months, while the 2002-2003 outbreak of severe acute respiratory syndrome, or SARS, killed 774 people over a period that lasted about 8 months. Total fatalities rose early Saturday in China after Hubei province, epicenter of the outbreak, reported 81 new deaths. Total deaths may be far higher, given reports of an overwhelmed health system in Hubei, central China. SARS also started in China and spread worldwide. In both cases, the actual total may be higher when taking into account the underreporting of cases. Key developments: China death toll at 722, confirmed cases at 34,546. World's retailers take hit as Chinese shoppers stay home. Death of a hero doctor sparks crisis of confidence in Zeiss. China-Japan cruise ship outbreak is now the biggest outside China with 61 sick. Bloomberg is tracking the outbreak on the terminal and online. Hong Kong imposes 25,000 Hong Kong dollars fine, jail term for breaking quarantine. 8 a.m. HK. The city's mandatory 14-day quarantine measure for all arrivals from China, effective from midnight Saturday, will carry a 25,000 Hong Kong dollars fine and a prison term of as long as 6 months, according to Hong Kong Chief Secretary Matthew Cheung. The quarantine applies to all arrivals who have been to China in the past 14 days. Hong Kong residents returning from China can quarantine at home, while non-residents can either quarantine at hotels or at designated facilities, Secretary for Food and Health Sophia Chan said. Hong Kong saw a spike in the number of arrivals before the quarantine was imposed, with the number of people entering the city reaching 82,017, a rise of almost 40% from the day earlier, city officials said Saturday. Royal Caribbean blocks Chinese from ships. 6 a.m. HK. Royal Caribbean Cruises Limited has barred passengers with Chinese, Hong Kong or Macau passports from boarding its ships this month, and will require extra screening for people who came in contact with someone who was in China in the past 15 days. These steps are very conservative, and we apologize that they will inconvenience some of our guests, the cruise operator said in a statement. In addition, the company said anyone who feels unwell or demonstrates flu-like symptoms or shows up with a fever will be denied boarding. Passengers on the company's Anthem of the Seas, docked in New Jersey, were cleared to leave Friday after more than 24 were screened for coronavirus, the first such cruise scare on U.S. shores. 4 passengers, Chinese nationals, went to a local hospital and tests are pending, the company said. The ship has been cleared to depart. Medical supply chain from China unaffected. 3:30 p.m. NY. The coronavirus hasn't led to any disruptions in the U.S. in the supply chain of medical and protective gear, much of which is made in China, officials from President Donald Trump's task force said at a briefing Friday where they updated the public on progress. Efforts to produce drugs to treat infections and vaccines to prevent new cases are proceeding smoothly, said Anthony Fauci, head of the National Institute of Allergy and Infectious Diseases. There are 2 studies underway using Gilead Sciences Inc.'s remdesivir to see if patients treated with it recover more quickly than those given standard supportive care. Efforts to start human studies of Moderna Inc.'s potential vaccine within the next 2.5 months are proceeding with no glitches, Fauci said. The U.S. is still waiting to hear from China about whether its offer to send experts in virology, drug development and epidemiology as part of a team from the World Health Organization will be accepted, Health and Human Services Secretary Alex Azar said at the briefing. U.S. ready to aid China, others. 2:30 p.m. NY. The U.S. is prepared to spend as much as $100 million to help China and other nations fighting the spread of the coronavirus, Secretary of State Michael Pompeo said Friday. The U.S. this week helped ship to China 17.8 tons of donated supplies, such as masks, gowns, gauze, respirators and other materials this week, he said in a statement. The financial assistance to foreign government is direct and through multilateral organizations, the SAT department said. Coronavirus spreads inside Wuhan Hospital, study finds 1:23 p.m. NY. A Chinese hospital taking care of patients with the novel coronavirus saw the infection spread at high rates among healthcare staff and other patients, according to a study of cases at a Wuhan hospital. The report, published in the Journal of the American Medical Association, looked at 138 patients from the Jiangnan Hospital of Wuhan University who had the coronavirus and developed pneumonia, which can be a sign that the infection has grown more severe. Many of the pneumonia cases were in workers and other patients at the hospital. Transmission within the hospital was responsible for about 41% of cases, including 40 health professionals and 17 other patients. Among the group of 138 patients, 26% required intensive care and 4.3% died, higher than other, broader estimates of fatality from the virus. Just 47 patients, or about one-third of the total, have been discharged.